Hey guys, Dr. Nate here again with my lovely wife, Dr. Christine, and we want to talk to you today about dental cavities. So I just heard this crazy new stat. In 2016, the CDC said that 90% of adults have had a cavity, but this is crazier. 1 in 4 adults in the US have untreated cavities. Okay, so let us talk about cavities. Number 1, what is a cavity?
So a cavity is an actual hole in the tooth that forms from when you're eating acidic foods, or when cavities are formed when you're eating foods that are high in sugar or processed carbohydrates, which cause for the bacteria that love that stuff, the S. mutans bacteria specifically. They love to eat that stuff and they metabolize it and they poop on your teeth, literally poop on your teeth, and it's very acidic. So over time that breaks down the enamel, and over time a little hole gets formed, and over time bacteria starts to infiltrate it and get into that softer layer and form a cavity.
Right, so this is so interesting, right? You have bacteria that are covering your teeth. That bacteria will take in the sugar that we are eating in our diets. They'll metabolize it, create an acid, and if you do not brush or floss that acid off your teeth, it forms in there and just gradually eats and eats and eats away at the teeth. And you know what? It loves to form in those little cavities, you know, those little pits and fissures, little areas.
The deep grooves of your teeth, yeah.
Because we can't get to it, right? It's harder to get to. And so if it gets there and it keeps eating away, it's gonna eat away that outer surface, that enamel surface, right? That's the hardest substance in our body, is that enamel surface. And then it goes down underneath that into the dentin layer. The dentin is not nearly as strong as the enamel. So you might have these little tiny dots on the enamel on the outer surface of your teeth, but once that bacteria gets down in there, it's gonna go into that dentin and spread like crazy. And if it gets close enough to the pulp chamber, what do we need to do?
A root canal.
A root canal, that's right? If the bacteria keeps going down there and keeps eating away, it's gonna get down to those nerves and blood vessels, and that's when you get the dreaded root canal, the tough root canal. And that's only because that cavity has spread so much, right? So the cavity is just a cavitation in the tooth. That's really all it is. The acids have eaten away enough that it gradually end up forming this big hole or cavity in the tooth.
Yep. And if you wait too long to go to your dentist, because sometimes you don't even notice that the cavity is forming, you may not even have any sensitivity. So that's why some people, you know, they haven't seen the dentist in a couple years and they walk in and then they find out that they need a root canal and they're like, well, I brush my teeth, like why? So that's the reason why.
All right, so now you know what a cavity is, a dental cavity is, but Dr. Christine, why the heck do cavities hurt?
Yes, cavities hurt. Once it gets big enough, a cavity will hurt a lot because the nerves inside of the tooth is compromised now that that protective, strong enamel on top is no longer covering and protecting the tooth. And so as bacteria starts to infiltrate the tooth, it can work its way down also into the pulp chamber, which is where all the nerve endings are and where the blood flow is through the tooth. It's what keeps the tooth alive. Once the bacteria gets in there and it's compromised, then the tooth starts to get inflamed. And so that inflammatory process causes great pain. It's one of the worst pains you could have when you have a toothache. That's exactly what it is.
Okay, so now we know what a cavity is. We know why it causes so much pain. Now, how the heck do we treat these cavities? So when it's a small little cavity, it's in through the enamel layer, just barely into the dentin layer, what we do is we remove the decayed structure, remove the decayed tooth structure, and we fill it with a filling. So it's pretty straightforward. We just take out all the stuff, put a filling in there. Very easy, very quick, no problem. But what if it has gotten a little bit bigger? Maybe the decay is, you know, taken out, maybe 2/3 of the tooth structure is compromised. You can't just do a filling anymore. It is way too big. We do something that is called a dental crown. And I've done tons of videos on crowns and bridges and all that fun stuff. So if you want, you can probably check it up. I'll probably put a link up here. But remember, if the decay has gone too big, you can't just do a filling. It moves into a crown. But what if it's got even bigger? You know, the decay has gone through the enamel, that protective layer, through the dentin, the kind of foamy layer, the not as strong layer as the enamel, and it's even gone into the pulp chamber. And the pulp chamber is where the nerves and the blood vessels of the tooth are. So if it gets into that area, you're definitely going to need a root canal. And root canal, what happens is we get these files and we take out the nerves, we take out the blood vessels, and we fill it up with an inert substance, mainly called gutta percha, and there's some other substances we put in there to make sure that you have no more pain. Sometimes if it's gotten that big, we might also give you antibiotics to help you with some of the infection, but you'll definitely need a root canal, and then on top of that will be a dental crown. So that is how you fix it. That is how you fix any type of dental cavity. I forgot to mention, if the cavity is actually bigger than that, it has gone past the pulp chamber, and it is just, you know, it's really big. Half the tooth is bombed out. Half the tooth is gonzo. You may not be able to fix it. At that point, you'll probably have to extract it, and you'll probably have to get a bridge or an implant. So remember, we do not want to get to that level, but that is at the worst case scenario.
And you always want to replace a missing tooth, because if you leave a missing tooth, it leads to bone loss and disfiguration of the jaw and the facial structures, and your teeth start to shift, and that causes all kinds of other problems that you don't want to start.
Okay, so now how do you tell, like how can you tell, or how does the dentist tell that you have a dental cavity?
Yes. Well, before you even go into the dentist, sometimes you can tell if you have a cavity if you notice some sensitivity to cold or sometimes hot. You may also notice when you're eating something, maybe sweets, it can start to get really sensitive. So you may also start not feel anything at all. So that's why it's very important to come to your dentist every 6 months for your checkups. We take x-rays, we do an exam, and we check, and we can detect those things that oftentimes most people can't see. Sometimes though, if you open up your own mouth and you take a close look at your teeth, you can see some darker spots on your teeth. You can see cavities that maybe have started to form. So they are very noticeable eventually.
Okay, so let's try to prevent dental cavities in the first place. How do we do that? I think step number one, so I love to talk about this because it's near and dear to my heart, but if you have crowded teeth or malaligned teeth, then come on in, because we need to straighten those guys up, because if you're brushing and flossing and the teeth are just overlapping, you probably can't brush and floss them well, and they're gonna be way more prone to decay. Along with that, you gotta make sure you're doing proper brushing and flossing. I don't think I know a single dentist who has a manual toothbrush. Almost everybody I know, actually everybody I know, uses an automatic toothbrush just because they're 1,000 times better than a manual toothbrush. So make sure you're brushing and flossing very properly.
You don't have to floss all your teeth, just the ones you wanna keep. So I always tell all my patients. So make sure you also come in for your routine checkups and dental visits every 6 months so that we can detect anything going on before it turns into this big whole thing that blows up in your face, right? Get it while it's small, and then also make sure that your diet is not full of, processed foods, like highly refined carbohydrates, sugary foods. That's exactly what that's like what cavity-causing bacteria just love to feast on and wreak havoc in your mouth.
All right guys, so now you know everything about cavities. You know what they are, how you get in them, how to prevent them, how we treat them. The next thing is, you probably may be wondering, if you're looking at this right now, especially on YouTube, is what is a dental crown or filling or an implant. So check out this video. It's going to talk to you about everything you need to know about dental crowns and dental implants.